I'm going to go over small bowel exam. So for small bowel exam, I get my patient, take them in the dressing room, and I would say to them, what I'm going to have you do is take off everything except for your underwear. You can leave those on as long as there's no metal snaps or buttons or anything on them. And I'm going to give you 2 gowns, one so it's open in the front, one so it's open in the back. That way you're covered all the way around. I'll also have you put your socks, or you can leave your socks on and then you can put your shoes back on, because depending on the procedure, we may have you walk back and forth from the dressing room to the procedure room. After that, I'll come back and grab you in just a second. So go back and grab them, bring them into the x-ray room. Can you verify your full name and date of birth for me? And is there any chance of pregnancy? When was your last menstrual period? So it looks like the doctor ordered a procedure called a small bowel. Does that sound familiar? Have you ever had that done before? Okay, can you tell me what's going on? So why are we doing this procedure today? Having some bloating, constipation, pain, things like that. Have you ever had any surgery on your abdomen before? Are you scheduled for a surgery anytime in the near future? Have you had any recent scopes where they stick a camera down your throat or up your rectum? Okay. Any pain, fever, bloating, distension, anything like that? Remember, we want to rule out the possibility of an obstruction or a perforation where we would not want to give them the barium sulfate. So after that, we'll just say, did you follow the prep that they told you to, MPO for 8 hours? Okay, great. So what we're going to do for this procedure is I'm going to have you drink 2 cups of barium. It is kind of like a flavored barium, but it doesn't taste that great. So what I'd like you to do is try to drink that down as quick as you can. You don't have to chug it, but I don't want you to just sip on it. The faster you can get it down, the sooner we can start the procedure. So what I do is as soon as you're done drinking, I'm just going to take timed pictures after that. The first one will be about 15, 20 to 30 minutes, depending on your facility. So I'll take a picture of you lying down. I actually have you lying down on your stomach to begin with. Do you have any problems lying on your stomach? Okay, good. So after that, we'll take a picture, and after each picture I take, I'm going to show it to the radiologist. And we're going to keep taking those timed pictures until the barium that we've given you to drink reaches a certain point in your small bowel. So the length of time for the exam is going to vary greatly, so it's patient dependent. So usually what I say is, if you tend to be more constipated, the exam might take a little bit longer. If you tend to have frequent bowel movements or diarrhea, the exam will be a little bit quicker. So I can't control how long the exam is. It depends on your body. Things that you can do to kind of help expedite the exam are, after you drink the barium, start to think about some of your favorite foods. That can kind of help get the digestive juices going, and it can move it along a little bit quicker. The other thing you can do is if we have time in between, you can kind of walk around in the dressing room or in the hallways. That can help a little bit. So after we're all done with those time pictures and that barium reaches that certain point in your intestines, the radiologist is actually going to come in, and they're going to use a different camera with live images, and they're going to take some additional imaging. They may use a paddle to kind of press on your abdomen a little bit to help move the loops of the bowel so they can see what they're trying to look for. After that, the procedure will be all done. You just need to make sure that you drink lots of extra fluids because the barium that we gave you can make you constipated. Also, just so there's no surprises, when you do have a bowel movement, it will be white from the barium that we gave you, so don't be alarmed. If you have any other questions or concerns, just reach out to your doctor after you leave here today. But that's it. Do you have any questions for me about the procedure?